I have here the Dr. Gaviria, and we'll talk about the latest technology when it comes to laser, about the vaginal restructuring.
Yes.
So, sir, Doc, first of all, could you please give us just a brief background of the apparatus or the technology that we're going that we launched today?
Yes, what we have is a solution for the vaginal dysfunction. And this vaginal dysfunction comes with age, comes with vaginal deliveries. So age is because menopausal women get less estrogen, and the tissue will atrophy, and they will have discomfort when they will have like intercourse, sexual intercourse. But also vaginal deliveries, overweight, a lot of the vaginal deliveries can get vaginal relaxation syndrome. So the patient feel loose. They don't enjoy the way that they felt when they have the sexual intercourse. So they don't have a lot of friction. And if they are very much relaxed, that epithelium can have like the patient has some she put stress like coughing, sneezing, and they will leak urine.
Yes.
So that's a stress urinary incontinence. But also if she feels like a bulge sensation, that is because a prolapse is coming. So the more relaxed the pelvic floor is, the more complications can be happening. So what we are doing is we have this photon laser that creates energy deposits, and that energy deposit, what it's going to do is shrink the collagen into the vagina to have better support. So it's going to have changes in the epithelium to have more lubrication, to have better pH, to lower down the chronic leukorrhea or infections, and it will have a good support for the movement of the vaginal walls. So the patient will be feeling that they don't pee or they don't have the bulge sensation. So it's an approach for non-surgical, in-office, 10-minute procedure, no downtime for this kind of dysfunction in the vaginal canal. But also, this laser can have aesthetic results. Aesthetics as laser vaginal vulvar bleaching, for the whitening of the area. And we can tight the labia majora so it will have a younger look. So there is some approaches that can also be surgical for treating cervical, for treating diseases, for labia trimming. So this is a laser that can have a lot of solutions for the patient problems in the genital area. And we are introducing this now in Manila because we have been in more than 30 countries, and we have more than 100,000 cases. More than 100,000 cases, and we are safe because the process of the laser to make the changes are non-ablative. That means that they don't vaporize. This means that they don't damage the epithelium. They just transmit the energy to make the changes. And this is important because we don't have those problems when it comes to the tissue renovation. It's just induction of renovation, but no by damaging. So no damage, no downtime.
Doc, what's the age of the youngest patient so far that undergo the treatment?
Well, most of the young patients that comes are young patients that have delivery and have vaginal relaxation syndrome. So they feel like they are loose, and they want that that friction sensation when they do the intercourse. So I will say that between 20s and 30s are for vaginal relaxation syndrome. Between 30s and 40s, I will say that they come for the stress urinary incontinence. And 40 up, they will come from prolapse. And if they are menopausal, they will come for the vaginal atrophy for the menopause. So we have like different functions, function for each age group. So there are different dysfunctions for age group. So we can have a menopausal woman who has the atrophy, who has the stress urinary incontinence because she has prolapse. So she has a whole different function. This you won't have in a 20 years old. In a 20 years old, you will have like she wants more friction, and maybe she will come for it. So we can have from 20s to 70s patients.
Okay, so there are different treatments, and each treatment costs different. I mean,
it's because it will have different laser exposure. So many passes, different protocols, and the more laser it needs, maybe the difference between the prices. But it's not like it's a double price or something like that. It's just a slight difference between the protocols. The four protocols: vaginal relaxation syndrome, atrophy, prolapse, and incontinence.
So would it be cheaper if I'll just get all of it? Would there be any discount just in case, or lesser price if you get the whole all the treatments?
Well, it's
if needed.
It's because the old treatment, is when you do a lot of laser, a lot of passes, because you need a lot of energy deposits. So you are assuming the different passes, and it's because we know that maybe one single pass costs something, and we have to pass 8 times. We are not to charge 8 times. So it is in account of the use of the technology, because we are using technology, and we need to understand that technology sometimes it costs. So, but it is that we need to understand that we are improving quality of life of the patient. We are improving sex life. We're improving date life when the patient is sneezing with their friends or taking a drink and they urinate. This is not quality of life. And we need to understand that for this, not to be surgical. That is just, you are in your job. You go in lunchtime to your doctor's office, 10 minutes procedure, and that's it.
There's
and
no
that's
downtime.
it. There's no downtime. This has to be done 3 times. So each month you go to the office and you get almost 80% of cure rate. This is something that the patient might appreciate.
Would there be any like complications, or do we need a doctor's certificate from, let's say, if I'm suffering from diabetes or other ailments, for you to proceed with the treatment? Or
there is no contraindications whatsoever. But we don't treat pregnant people. We don't treat patients that have menstrual period or infections. Why? Because the vaginal canal will be blockaded by blood or by the infection, so we cannot administrate the laser. So these are the contraindications. We don't get downtime because we don't get side effects. What we get is sometimes we get a little bit of more vaginal discharge because the lubrication is improving. So this is like an expected side effect that we are aiming for. We are aiming for better lubrication. So it is not a side effect at all. It is a show that we are improving the epithelium.
You mentioned it's now in Manila. Is it available already, or are you training doctors?
What we say that we are launching is because me as a pioneer since 2010 working with this, and I've been doing this first article in this Intimalace, is that we are launching for a lot of the doctors who doesn't know about this protocol, but we are already here in Manila, and there are some doctors that are well trained for doing this treatment, and it's so safe that the learning curve is very easy to achieve. So we get a universal protocol so you can get the results from Manila doctors as you are getting it with me, because the protocol is the same. What it changed is the patient capability to restore the epithelium or to make collagen, and that comes with age. So maybe if I treat 30, is not she will repair more than the 60. But maybe if I treat a 60 in Manila and I treat 60 years old in Venezuela, they will have different change. Why? Dietary habits.
Dietary habits.
The race also, Asian race, Latino race, sometimes there is capability to repair better than the others. So we can expect that, but it's not like that the Asians going to repair 100% and mine is going to repair 40. We're talking about a small, slight difference. And this is good because you don't need to travel to Venezuela to get good repair.
Because it's not here.
Because it's all now available here.
Okay. When you say available, is there any, like for me, if I'm interested to check out the doctors, would there be a website that I should go through to be able to know if this particular doctor is accredited or to use the...
For general, what we have is every distributor in every country in their webpage advertise which doctor has been certified, and this is very important because it's not just to buy a laser by email, like I want, and they bring them from China, Korea, or whatever, and then you don't know how to be done. This is certified by the distributor that he or she has been trained with one of our doctors, so she's qualified to deliver energy and safe treatment. So I will say that you have to go to a SpectrumMed webpage to get these kind of doctors, or just email them. So they will. Where are you, and which one is your closest or nearest provider?
Because me.
Okay, so doctor, tests are needed before proceeding to any treatments, right?
What?
Tests.
Oh, well, we ask the patient to have a pap smear, so we know that she don't have an infection. But we don't prepare the patient or we give medication after. It's no needed. But if you give some kind of topical reepithelialization cream or for gel for the vaginal canal, it will repair faster. It's not needed, but it will repair faster. So pap smear test is essential.
Second question, for incontinence or
vaginal tightening?
Yeah, tightening. So how often do a woman need to do this, especially when she is sexually active?
Well, what we recommend is 3 sessions, every month. And that's the treatment. And I tell my patient, come back whenever you need it. Because this vaginal sensation is very subjective. I cannot objectively say that she needs it. Because also it's the sexual partner. I don't know how's the sexual partner, maybe she changed, and I this is something that I cannot measure. But patients say that vaginal tightening, when you don't have defects, like a 25 years old girl that she didn't have any delivery, can last for almost 5 years.
Ooh, wow.
But if you're in the 30s and you got kind of some dysfunction, you might need maintenance every year.
At least once a year.
Yes,
So
once
it
a
still
year.
depends on the age.
And
It depends on the age or the dysfunction.
Okay.
Because maybe a patient is 20 and she already have 3 kids. Maybe she will have a different dysfunction than any other. So,
For example, if I had a degree and then I had a vaginal tightening, then I have another baby, then I should.
then you should, because you are creating collagen. It's like you want a face tight. You are creating collagen, but the collagen will wear down. This has happened with age. So you want a maintenance. See, so this is kind of maintenance. Then the meaning that you have another kid, what I recommend is to get a vaginal tightening right away after you deliver, like 40 days after. So you will help with the repairing of the tissue, so you won't have dysfunction like SUI or prolapse.
It doesn't have it, I think, for example, the mother is breastfed.
Well, it's because it is so localized that we don't have any changes in lectins.
I also have a question, Doctor. You mentioned that you've been using it for like since 2010.
Ten.
So that's how long this technology is.
Yes, we start using it in the first proof was made in 2009.
Oh, so that's 2009.
So it's almost 10 years. But clinical evidence has come since 2012. So first was trials, clinical studies, and since 2012 and so on, clinical trials, 2015 or 14, FDA and Europe brands who are certified. So I will say that is a very safe procedure because we have not been pronounced by the FDA and we don't have any kind of problems within any reports of complications.
So this is approved by FDA already.
It is FDA
Okay,
approved.
very good. Nice. Okay. Last, doctor, can you invite everyone to try the treatment?
Well, I am Jorge Gaviria. I am a doctor from Venezuela. I actually work in Spain. I am a gynecologist, aesthetic doctor, and laser specialist who has been working with vaginal treatments, with laser vaginal treatments, almost for almost 10 years. And I can say that it's an effective, safe procedure for vaginal relaxation syndrome, stress urinary incontinence, prolapse, and genitourinary syndrome of menopause. So I encourage everybody who feels that she might have this kind of problems to get to your doctor and ask for the procedures or find out who's your provider. So thank you so much for seeing this.
Thank you, doctor. So that's it, guys. So sabi nga nila, it's never too early or too late to do the treatments. It's not only for sexual reason, but for, alam nyo na, yung kasi as we age, medyo yung ating urine minsan hindi na natin napipigilan. It's a good thing that there's this kind of treatment na pwede natin gawin. So as you heard from the doctor, it's actually safe, there's no downtime. So check out the website of Spectrum Med para ma-check natin kung yung mga doctors na kumbaga is licensed and nag-undergo na ng training para magamit tong treatment na to. So till next event.